Hello, everyone, and welcome back to the Down Syndrome Center of Western Pennsylvania podcast. As always, I'm your host, Dr. Kishore Velody, and I am really excited about this podcast today. We have a return guest, Dr. Brian Skotko. Dr. Skotko, if you remember, was a part of a prior podcast along with Sue Levine as they were talking about sibling issues, which I'm sure Dr. Skotko will give us a reminder of why that's important to him, as all of you know is so important to me as well. But today, we're going to have a different topic altogether. We're going to talk about this new and really innovative concept called DSC2U. You may or may not have heard of this, but by the end of this podcast, I think you will find it as exciting as I do in terms of a way of reaching out to families with information, because information is power, particularly when it comes to the healthcare of people with Down syndrome. And so we're really excited to talk about this today. So Dr. Skotko, thank you so much for joining us again.
Okay, sure. Thanks so much for having me back. Great to be here.
So how about this? Before we get too far into it, in case someone hasn't listened to the prior sibling podcast, they may not know much about you. So tell us a little bit about who you are, what you do, and why you love people with Down syndrome.
Well, just like you, I'm a sibling. And so my sister with Down syndrome definitely is a life coach in so many ways. She brought me to medicine. It's because of her and so many friends. I wanted to grow up and be a doctor one day. So I'm very lucky I get to do that in the Down syndrome program at Massachusetts General Hospital.
And tell me, what is it like that you see, and even in your studies that you've done, in terms of access for people with Down syndrome? You know, because you work in a big city in Boston, I work in a big city in Pittsburgh. So for a family to come to our Down syndrome centers, it's like, okay, yeah, drive down the street for many of them. But what is the issue in terms of access? What have you guys found?
Yeah. You know, Kishore, we've counted and we think there are more than 213,000 Americans with Down syndrome in the United States. And, you know, there's 72 of these Down syndrome specialty clinics that you and your team, my team, and others run around the country. And 72 seems like a lot of clinics. But when you add up to our full capacity, all of us at best are probably only able to serve 5% of the total population of people with Down syndrome. So it means 95% of people with Down syndrome are out there without geographic or financial access to our clinics. And so they're working with their primary care doctors. And most primary care doctors probably only have one or two patients with Down syndrome in their practice. So it is really unreasonable and impractical to think that today's primary care physician is going to be able to stay up to date on everything. You and I live and breathe Down syndrome, and I still find it tough to stay up to date on everything. And so this really got us thinking, how do we capture the knowledge that we're lucky to learn with our patients in our specialty clinics and try to be able to bring that to the 95% of people within our own country who can't access our clinics?
Yeah, and I agree with you. And I think there's been so many studies that have shown that even a great primary care doctor, it's so hard for them to stay up to date with all of these guidelines, the American Academy of Pediatrics guidelines, and now, of course, the adult guidelines that just came out. They're so long and it's so hard to do in a 10 or 15-minute visit for a primary care doctor. So it was really exciting when you first started sharing about this DSC2U idea. And now, of course, it's published and it's been shown to be effective. What is it? What is DSC2U?
You know, what our team did in collaboration with great physicians around the country with caregivers, we had moms and dads hand in hand with us making this with people with Down syndrome and with primary care doctors. We basically downloaded our brains of what are the things and questions we ask in clinic and what are the combination of responses that give results. So when people go to Down syndrome clinic to you, there is an online form. They answer questions about their loved one with Down syndrome. And then when they press submit, they will automatically be taken to their own portal where they're going to be given a personalized checklist for them as the caregivers and a corresponding checklist to go to the primary care physician. And the output from that comes from all the algorithms that we together have put together based on either the guidelines that you mentioned or on our expertise and our years of experience collectively working with people with Down syndrome.
That's really exciting. So who can use this? Like, is this something that's easily accessed? They just go to a website and then they can put this information in?
You know, we were lucky. We built this with a grant from the Patient-Centered Outcome Research Institute, PCORI, and we had enough funding to be able to build this in both English and in Spanish. And it is now launched. So I'm really excited that anyone around the globe who has access to the internet, who can access material in English and Spanish, this is ready for you. Of course, we have built it based on the way we practice medicine in the United States. And as long as people understand that and want to access it, Down Syndrome Clinic to You is ready to go.
So if a family has like a fantastic primary care doctor, let's say they feel like this primary care doctor is great and is being really up to date with, as far as they can tell, with the guidelines, what would be the benefit for somebody then to use DSC2U?
I am so excited, I'm sure you are too, when someone says, I have a great primary care doctor,
Yeah,
because we need good doctors to take care of the other 46 chromosomes, right?
that's
But
right.
you and I know that extra chromosome really, really well. And I have found that any parent who goes through Down syndrome clinic to you, or comes to our in-person clinic for that matter, there's always one or two tune-ups that they learn. And sometimes you don't know what you don't know. And so what we want to provide is that knowledge about that extra chromosome, so that in conjunction with the primary care doctor, together families can make sure that they're up to date on the latest guidelines and the latest information.
So let me ask you this tough question then for both of us, as being people who work in Down syndrome centers, who run them. What would be the benefit perhaps for a family who's seeing one of us? Would there be a benefit for them to use DSC2U as well as seeing us at the same time in our Down syndrome center?
Just to be honest, I know you and I and so many of our colleagues know running our in-person Down syndrome clinics is a labor of love, but they're very expensive. And most of our Down syndrome clinics are not very financially sustainable. So if we look into the future, we're starting to see some of the in-person Down syndrome clinics starting to close, some of our colleagues, and where will we all be in the future? So we really wanted to guarantee that there will always be an online presence that is scalable. What I hope is that the majority of people out there will be able to go through Down syndrome clinic to you as their front door, and with their primary care doctor, they could turn their primary care doctor into a specially Down syndrome clinic. But then for those who don't get all their questions answered, I hope that there will be remaining in-person clinics like the one you run, the one I have run, so that those patients with really tough presentations or those patients with really peculiar presentations will still be able to come to see us. Now, if someone is already in our clinic, we're not booting them out. And I know you now are not either. And if they want to complete Down syndrome clinic too, I think that would be great. And we'll be able to see how it works. But I think for families that do have access to in-person clinics, Down syndrome clinic to you is probably not as necessary as those families who are working just solely with their primary care physicians.
Awesome. I'm glad. I wouldn't want to give up what we do. I'm sure you wouldn't either. So in terms of the bottom line, how much does something like this cost? Is this something that insurances will cover? Like, how does this work?
So right now for a one-time use, it's $49. And the reason why we're charging is we need to make sure that the machinery is up to date and it's going to be sustainable. And so we're hoping that those user fees will allow us to secure the data continuously, allow us to be able to update the algorithms, and allow us to provide the help desk and the support that families need. Our hope is for this to be financially sustainable so that the Down syndrome community funds it and continues going in the future. We're lucky enough, we actually got a philanthropic donation from the Lumine IDSC Foundation to be able to provide the funds we need for the next 3 years to keep this going. But after that, we're really on our own to be able to make sure that this is sustainable. And I really want to make sure, because I know $49 might even be a stretch for accessibility for many of our families. And so we've been starting to reach out to insurance companies. And, I'm just a doctor. I've never talked to insurance companies before. And I presented the data to them. And it hasn't been a hard sell, because what are we doing? We're trying to bring high-level specialty care into a low-cost setting, primary care setting. And so already we've gotten some verbal commitments from some major insurance companies who want to fully subsidize the cost of this for their members. And so our team over the next several years are going to continue to talk to insurance companies. And on our website, we'll be listing which insurance companies completely fund it. I should also say some Down syndrome nonprofit organizations, your local Down syndrome organizations, also want to subsidize for their members. So I know many of them are doing walks and doing runs, and they want to bring the gift of health to their members. So a lot of them have already reached out and said, we want to buy coupons or access for our members. So I would tell everyone, before you sign up for it, just check in with your local Down syndrome group, because they may already have coupons ready for you.
That's fantastic. And once somebody pays that into that fee, how many times can they access it? Is this like a lifelong membership, or how does that work, the $49?
So once you sign up for it and you get your portal of your outputs, you could go and revisit those outputs as many times as you want. If you have new symptoms and it's the next year and the next wellness visit, we're encouraging everyone to think about this every time you have your annual wellness visit. It will be new symptoms and a whole new report generated. So that will be an additional fee. But every time you pay a fee, your reports will always be there for you to access.
That's so great, and I love the fact. I think you alluded to it a little bit a moment ago that this takes a lot of effort. I mean, I just think about you and me and everybody who does what we do. Like we're pretty busy all the time with this, and for you to be able and your team to be able to put aside some time to put this together, I know it's not cheap, and I know it's not easy to do all of that. That funding source. Share it again. Like how are you guys able to keep doing what you're doing?
Yeah, so we were able to have a grant from the P. Corey Foundation to build this. And once it was built, then we got that generous grant from the LumMind IDSC Foundation, which allows us to be able to figure out how to launch this. We need to make this financially sustainable. And I know that our community will help us out. So we're looking through either coupons through the local group's insurance subsidizations or user fees to be able to keep this going. But I also think more than just financially sustainable, we need to keep this medically sustainable. And Down Syndrome Clinic to You will only be as valuable as it is up to date. And Kishore, you know, our colleagues are producing so many great handouts, podcasts like you, books that are being written. And anytime these come out, we want to feed them into our system. So when someone might get a recommendation on obstructive sleep apnea, we'll be able to say, hey, listen to this podcast that you've done on obstructive sleep apnea and read this handout that comes from our colleagues. And so we really consider this a team sport and a team effort and kind of all of us working together to feed the system.
And, you know, and one thing, because I know that the latest publication that you guys had really showed a positive impact. Is that something that, am I reading that correctly? Like when people access this, somebody maybe who's never been to a Down syndrome center before, does it actually impact the child getting the appropriate care? Is that what you guys have found?
Yeah, we wanted to prove it. We thought it would be helpful, but we needed to prove it. So we did a national randomized controlled trial where we got 230 people from around the country. We had loved ones with Down syndrome who did not go to one of our specialty clinics. Half of the people got access to Down Syndrome Clinic to You. The other half did not. And we followed them for about a year where we measured the impact that this was having on their conversations with their primary care doctor. And for those who had access to Down Syndrome Clinic to You, they had a 1.6-fold increase in the number of actions that should have been implemented based on the American Academy of Pediatric guidelines. So we were able to show that it was effective, but we also were able to learn from caregivers that they liked it, and primary care doctors also thought it was helpful without being too onerous.
That's fantastic. Well, Brian, I say as one sibling to another, I think this is so cool. It's so cool. It's such a great way to give back. I know, you know, when my brother was born, and certainly when your sister was most likely as well, there wasn't anything, not even in-person Down syndrome centers, really, in the way that we have them now. And this DSC2U bringing it really globally, you could think, anywhere that anyone has access to the internet. What is the website that people would use? And I'll put this in the show notes, but what would they want to use to access this service?
If someone just Googles Down Syndrome Clinic to You, it should come up. But the website is DSC2U.org. So DSC2U.org.
Perfect. And I will put that in the show notes. But anything else you wanted to share with our listeners before we sign off here?
I would just say to everyone out there, give it a try, see what you think of it. We continue to want people's feedback as well. And I hope, again, that this will bring even better health to people with Down syndrome in their local communities. Thank you so much.
All right. Yeah. Thank you, Brian. And I tell you what, thank you for really everything that you do to further the knowledge when it comes to care with people with Down syndrome. There's rarely a talk that I'll give that doesn't have some Skotko article at the bottom highlighted. So I really appreciate all the work you're doing. And of course, with DSC2U as well. For our listeners, I hope you found this very helpful, and certainly please take a look at the DSC2U and make use of it. See if it's something that your primary care provider and your child or loved one with Down syndrome would find helpful as well. And as always, guys, I really appreciate all of the recommendations that people are sending in terms of things that you would like us to talk about on the podcast. It's really been fantastic, and it's helpful for me to know what the needs are out there. So keep sending those to Down Syndrome Center at chp.edu, and we will gladly find speakers and address those things. But until next time, bye-bye.